Dr. Marcus, could you please tell us about the recently released report and how it differs from the prior report?
The report that we just released, the Phase 2 Curb to Curb report, looks at the aviation system through the lens of the airport. So when you arrive at the airport, go to check in, go through security, get to your gate. And then on the other side of your journey, your travel through the airport of your transferring or your return, all the way to baggage claim. It complements our first report, which was gate to gate, which was on board the aircraft. So those two reports together give you a good view of the full aviation system, whether through the lens of someone who's working in the system or through the lens of someone who's a passenger in the system.
What are the key findings in this Aviation Public Health Initiative Phase 2 Curb to Curb report?
The Phase 2 report complements our first report on onboard aircraft, so airport and aircraft. And what we found in common is the importance of a multi-layered approach to stem the transmission of the COVID-19 disease. And that combination of strategies protect you, the passenger, protect other people who are in the airport and are part of an overall strategy to reduce transmission of the disease. That multiple layers includes the ventilation system to keep airflow going so that the likelihood of getting a viral load that could give you the disease is reduced. It includes disinfection of surfaces so that we're in a clean environment. And most importantly, it involves behavior of passengers and workers wearing a mask in accordance with recent recommendations from the CDC, even in wearing two masks, a surgical mask on the bottom and a cloth mask over that. Keeping your hands clean, not touching your face. And if you need to drink or eat, to very, very quickly remove your mask, drink or eat underneath that mask, and then return it as soon as you can. It's that multiple layers, which are part of both the airport and the aircraft report, that reduces the risk of transmission of the disease for people who are going through the aviation system.
Your report describes a layered approach that the airports, like the airlines, are taking to reduce coronavirus risk in airports. Are you saying that if all these strategies are consistently adopted, that airports are a safe environment?
What we say is that while COVID-19, while the disease is still spreading throughout the community, there are always risks, and all of us have to attend to those risks and behave in ways to reduce those risks. Part of that is from the operators of aircraft, the operators of airports, to create as clean an environment in terms of the airflow as possible. And part of it also is our taking our own, assuming responsibility for wearing masks and engaging in public health activities to reduce the risks. So what we say is that it's possible to reduce the risks, but those risks will always be in play until COVID-19 is really behind us.
As the country looks forward to the vaccination program and economic recovery, how do you see the aviation industry using this report in the future?
One of the things that we study in the National Preparedness Leadership Initiative is the course of a crisis. And one of the fascinating things that we're finding in the COVID-19 crisis is there are times that we can anticipate what's going to come next. And when we get there, only at that point do we start planning. Only at that point do we start getting ready. Of course, we've known for a long time that we were going to be getting to the point where vaccinations were ready. And in observing this process, the planning and the logistics that could have been gotten into place beforehand simply weren't there. So we now have the availability of vaccinations. And in many states, what we're finding is that we're only beginning to do the planning and the logistical operations to get things going. So here's the way the aviation system could use this report going forward. Today is the day to start planning for the next phases of this crisis, when we can see that there's recovery, when we can see that's resilience, when large portions of the population have been vaccinated, thereby reducing the risks of air travel. And once we get to that point, that's when the measures, the recommendations in this report can be of extraordinary value, because we're still going to have to be careful. We're still going to have to be reducing the risk of transmission so that we can take the step-by-step process of getting beyond this disease. And we're only going to do that in that interim period if we continue wearing masks, if we continue attending to questions of ventilation, and continuing to work together to reduce the risk of transmission. So the recommendations of this report can be used today to help people in the aviation system get ready for the next phase of the COVID-19 crisis.
As vaccines become more widespread, more and more people will begin to fly. What advice do you have for airports as the crowds return?
Among the things that we know about COVID-19 is that we've got to be very careful about people coming into close distance and into close proximity to one another for long periods of time. So what we encourage airport operators to do is to use the extent of their square footage in their airport to be able to distribute people as widely as possible so that they're not in crowded areas, or if they have to get into narrow areas like the jet bridge, we keep distance between people. So it's possible right now to practice doing that, to look at ways to get that done, to keep spaces open, to encourage people to spread out as much as possible through the area of the airport. To do that now, to encourage that kind of distancing now, so that as more and more people come into play, there will be policies and procedures and practices that can help maintain that distance until COVID-19 is truly behind us. We're going to have to learn how to live with this disease in different ways once a large portion of the population is vaccinated and as people start traveling once again.
Do you agree with a national mask requirement on airplanes and in airports? Why should it be a federal requirement and not just left up to airlines and airports as it had been?
We totally support the mask requirement as federal law. First off, masks are the first and most important line of defense. So we would like to see people around the country who are moving through the aviation system to be wearing masks. Second, we found that it puts flight attendants 30,000 feet in the air or airport workers in a very difficult position if they're having to deal with passengers who are unwilling to comply. So this helps them. And if everybody going through the airport, everybody on board aircraft are wearing masks, it's a real important factor in the overall multi-layered approach to reduce the transmission of disease. So with that, yes, just like you're required to wear a seatbelt, you're required to wear that face mask. It'll keep everybody safer, and it will help us all reduce the risks of transmission through the aviation system.